Hi, thank you for joining me. This is Dr. Erica. Please like, share, and subscribe if you haven't already. My main channel, Erica Onigbola Farm D. On this video, I am talking about probiotic therapy, and I have some examples that I'm going to show you, so please stay tuned to the end of the video. Talking about probiotics. So what is a probiotic? A probiotic is a supplement for the GI tract or gastrointestinal tract or gut flora, microbiome, bacteria growth that normally happens in the digestive system post the stomach sphincter. And that's the area or anatomy that I'm talking about. These products that I'm going to show you, tablet, capsule, gummy, and herbal tea, uh, bacterial probiotic once daily or twice daily, as suggested based upon the manufacturer, is going to work by replenishing the lost bacteria that occurs during surgery, during loose stool or diarrhea episodes, irritable bowel syndrome, constipation, irritable bowel syndrome, diarrhea, also post colorectal procedures. You can also take them post procedure or post surgery. Your doctor or surgeon will direct you as to the duration of time to use and also the brand, possibly. There are different types of brand. As a pharmacist, I don't recommend one brand over another brand. Just make sure you take for the duration of time that's recommended by your physician or surgeon. So the first I'm going to show you is a gummy. It's a gummy package, and it is a dual acting. This one has energy and it has a probiotic, and it's a digestive probiotic. For easy digestion, it's a gummy and it's flavored. So that helps with the taste, helps with taking it twice daily, it says. And it has Bacillus coagulans. But Bacillus coagulans is a species of bacteria that is normally in the gut, and it's going to help replenish and balance out the gut flora. Bacillus coagulans. Then there's the tea form. You can get green tea, probiotic, and you can use that once or twice daily. You can add honey, or you can add a small, maybe half teaspoon of sugar to go with the green tea once, twice daily. And the Bacillus coagulans is also in the tea as well. So that's going to be your replenishment. And then the next one I'm going to show you is by Shift manufacturer. Bacillus coagulans is the active ingredient for both of these. One is a regular strength, and then you can also purchase probiotics in extra strength. You can also get probiotics through yogurt as well. Yogurt is a natural producer of bacteria. And this one has a prebiotic and a probiotic, and I'll go over prebiotic towards the end of the video. Okay, so this one is going to have a prebiotic and a probiotic, Bacillus coagulans again, and it works naturally, going to help support the gut system. It also helps with the immune health as well. This is a tablet form. If you're interested, it's tablet form. And the next one is going to be a capsule form, also by the same manufacturer. And then you get this one, you get yogurt, you get probiotic, the same amount versus yogurt and the leading probiotic, it says. So when you eat yogurt, you're naturally going to get a natural amount of the Bacillus coagulans. But with the supplement, you're not going to get as much. But this particular one is called the advantage. So the advantage is going to help with the normal amount yogurt, that a cup of yogurt or a leading Greek yogurt would have, promoting once daily use. I suggest drinking it with maybe a small 8 ounce, 4 ounce to 8 ounce of water or liquid, and giving that maybe 2 to 4 hours separation from your other medications or supplements to make sure that it is working properly and effectively. So a prebiotics are usually going to be dosed before a surgery or before the disruption of the microbiome. So what you're going to do is take the prebiotic some time before the procedure, and then after the procedure you're going to take a probiotic to help replenish, if that makes sense. A prebiotic is going to stabilize and maintain, whereas a probiotic is going to replenish what has been depleted. So that is the difference between a prebiotic and a probiotic. A prebiotic may also have fiber. It's going to help with the immune system. It's going to help with stomach upset. So naturally, the prebiotic will do just as well as a probiotic. But when you eat natural foods like your yogurt, dairy products, you can also get probiotic in milk form as well. There is a brand, it's on the a brand that has a probiotic formulation, a brand of milk. Check your dairy, check for yogurt as well, and you should be able to get a milk form of probiotic if the tablet, gummy, or capsule formulation does not work for you. But I'm trying the new green tea formulation today. I'm trying it out just to see how it works with my GI system. Do I feel any different? Do I feel less gaseous? Do I feel less bloated? How do I feel? So I've never tried a probiotic after or in the formulation of a tea or liquid. So I'm giving this one a try today, and I want you to try it out. Try it out for yourself as well. Leave me a feedback or a comment. Let me know what you think. Ginger, it has ginger in it, which helps with digestive system as well. It helps with nausea, it helps with vomiting, it helps to regulate the emesis and vomiting reflex. So ginger is good for the GI tract as well. So I'm glad that they incorporated both of those, probiotic and ginger, together. If you add honey to it, that'll be even better, because honey helps with colds, it helps with congestion, chest, throat congestion. It helps to help with the sinus clearing. So honey is good if you add that to your ginger tea and your green tea. Green tea is an antioxidant. It has plenty of nutritional value. So you can't go wrong with the green tea probiotic ginger formulation. Add your little honey in there and drink it very hot, and you should be okay if you're dealing with those symptoms and want to try it out for something new. So that's what I have for this video. Thank you for joining me. This is Dr. Erica. Hope to see you on my next video. Like, share, and subscribe. Take care. Signing off. Bye-bye.